Alright guys, so we're here today in the operating room. We're doing a deep plane facelift. I'm going to guide you through how I perform my markings. This is something that a lot of patients ask me. Also some of the doctors that come to see us in the operating room. So I'm going to go and start with the pre-auricular incision. So there is always an incision in front of the ear, and a few of the key concepts that I like to preserve. In fact, I'm gonna change this a little bit, but essentially I look at the superior helix here, this thickness there, and I try to mimic that same with the incision. So I try to keep that incision more or less in the same thickness. I adjusted this one just now. Then we go behind the tragus to hide that incision, but here is another key aspect to it, and you don't want to go all the way down to this area. You want to kind of finish that tragus, so you move anterior and then around it. And while we do that, we actually mark it with no tension, with the skin stretched. I think that's also very important. Otherwise, you see patients that end up with the incisions too anterior, and that's something that they always ask. When it comes to the back, they see the incision is hidden in that crease behind the ear. So we're doing a full face and neck. Therefore, that incision goes behind the ear, but it also crosses over to the hairline posteriorly. Then the next question is how long that incision in the back has to be. So if we're just doing the face or an extended, some minor work in the neck, an extended deep plane, the incision can actually just end right there, just behind the ear. If I'm doing a full neck lift, then the incision extends all the way down here. And how far down here, where it really depends how much excess skin the patient has. So in this case, I have them bend or flex their neck in the pre-op, and I mark this line here. And when I'm doing my markings for the back, I actually continue that all the way, and that's how I know how far down to make my incision in here. So in this case, we're doing a full deep plane face and neck lift. She has incisions anterior to the ear, posterior to the ear, and they also extend along the hairline. So that's how I perform my markings for a deep plane facelift and a neck lift.